Green eyes are usually associated with beauty, but according to one expert, they also come with a small chance of some worrying health effects. There's something uniquely captivating about green eyes, which might explain why more respondents in one survey chose green as the most attractive eye color than any other hue.
Oh, whoa, look at those vivid colors. Look at my eyes. Those are Shrek green eyes.
However, green eyes aren't as mysterious as they may seem, and they could even come with a few disadvantages. Glam spoke with Dr. John T. Lind, Associate Professor of Ophthalmology at the Indiana University School of Medicine, for insights on the alluring feature. The color all comes down to the iris, the part of the eye located behind the cornea, surrounded by the white part. He explained, "What determines eye color is the amount of melanin that is in the iris. Due to genetics and environmental factors, the amount of melanin varies in each individual. People with green irises tend to have less pigment. Put simply, the amount of dark pigment is generally the only thing setting green eyes apart from blue or brown ones. Still, this pigment can play a major role in eye health, and green-eyed folks may run into unique issues if they don't properly care for their peepers. The light jade-colored effect that makes green eyes stand out could also make them more susceptible to some serious conditions. One such condition is ocular melanoma, which Dr. Lind explained is a life-threatening cancer that can spread to other parts of the body. He added that people with blue and green eyes are also more at risk of developing other types of skin cancer. Experts aren't entirely sure what causes melanoma of the eye, though light eyes and light skin are considered risk factors. Macular degeneration is another condition that may occur more often in people with light and green-colored eyes, says Dr. Lind. The disease affects the retina and can result in a loss of central vision. On top of that, Lind said, another condition is called heterochromia, where each iris can have different colors. This could be caused by many things, including trauma, other ocular conditions like inflammation, or a neurologic condition called Horner's syndrome. Famous faces with heterochromia include Mila Kunis, who underwent surgery to correct her eyes, and Kate Bosworth. If you notice your eyes vary in color or change tint over time, Dr. Lind suggests visiting an eye care professional to rule out serious conditions.
You'll notice it's royal blue to match your pretty little eyes.
My eyes are green.
If you have green eyes and feel easily blinded by the sun and other bright lights, it's not all in your head. Dr. Lind explained, patients with lighter colored irides tend to be more light sensitive. This is likely due to the lack of melanin of the iris and patients having greater glare due to light scatter. That's why you might not be able to stand to look at the sky for more than 5 seconds on a sunny day, while your brown-eyed friend isn't as affected. The best thing you can do for that particular problem is block out harsh lights with sunglasses. Lind recommends choosing a pair that protects the eyes against UVA and UVB radiation, and that has anti-reflective and polarized lenses. And there's one specific color that could help the most: yellow. Lind said, patients that are predisposed to glaucoma and macular degeneration can try yellow-tinted glasses instead of gray tint, as yellow tint can actually improve contrast sensitivity. Caring for your eyes isn't just important to protect their gorgeous green color, it's essential to maintain their health too. When you neglect your peepers, you could be at increased risk of suffering from vision loss, damage, and eye diseases. Thankfully, maintaining eye health doesn't have to be complicated. Dr. John T. Lind's advice? Stay on top of regular visits with your eye doctor, which is especially important if you haven't been in a while.
Oh my God. What does that thing do?
That's an eye removal machine.
Even if your eyesight is in tip-top shape, you should see a professional at least once in your 20s and twice in your 30s. Adults in their 40s and older should see an eye doctor more often. Once every 1 or 2 years is a good rule of thumb. That's true for anyone, regardless of eye color.